Which of the following characteristics describes a hollow fiber dialyzer? A. Fibers about 1 centimeter in width. B. Very fine fiber tubes held in place by polyurethane material. C. A high resistance in the fibers, enhancing ultrafiltration pressure. The following are referred to as the sieving coefficient of a membrane. A. Size of the pores in the membrane. B. Fraction of solute that passes through the membrane by convection. C. Amount of water required for solute drag through the membrane. What is the most probable reason for post-renal failure? A. Glomerulonephritis. B. Benign prostatic hypertrophy. C. Severe dehydration. D. Nephrotoxic drug. The kidneys create each and every one of the following, but which one? A. Calcitriol. B. Renin. C. Aldosterone. D. Erythropoietin. The most common cause of chronic kidney disease in the United States is A. Glomerulonephritis. B. Polycystic kidney disease. C. Diabetes. D. Hypertension. An arteriovenous shunt, AVS, and an arteriovenous fistula, AVF, vary primarily by having an A. AVF requires an external tube. B. AVS is entirely within the arm. C. AVF is entirely within the arm. D. AVF is more likely to become clotted or infected. Chronic renal failure is accompanied by all of the following, except A. Hypoparathyroidism. B. Hyperkalemia. C. Hyperphosphatemia. D. Low hemoglobin. What exemplifies biocompatibility the best is A. Independence from protein absorption of the membrane. B. Reprocessed dialyzers that have a lower biocompatibility than new ones. C. Reprocessed dialyzers that have better biocompatibility than new ones. Which dialyzer from the list below is in use right now? A. Coil. B. Hollow tube. C. Kill. D. Flat plate. Which hemodialysis regimen is most likely to be effective? A. Short daily home hemodialysis, 2-3 hours a session, 5-7 days a week. B. Nocturnal home hemodialysis, 8 hours during sleep, 3 days a week. C. In-center hemodialysis, 3-4 hours a session, 3 days a week. Most patients receiving in-center hemodialysis have a hydration restriction equivalent to urine volume day plus A. 1 L. B. 2 L. C. 0 L. D. 0.5 L. One body part's water can be transferred to another by A. Osmotic forces. B. Ultrafiltration. C. Active transport. D. All of the above. Before an exercise study, a pulmonary function technologist finds that the patient's RER is 1.13. Which of the following best explains this finding? A. Carbohydrate metabolism. B. Protein metabolism. C. Hypoventilation. An essential indicator of renal function is the glomerular filtration rate, which in a healthy adult is roughly A. 125 milliliters min 1.73 square meters. B. 200 milliliters min 1.73 square meters. C. 50 milliliters min 1.73 square meters. D. 75 milliliters min 1.73 square meters. Patients with renal failure who fail to eliminate beta-2 microglobulin are more likely to A. Seizure. B. Pericarditis. C. Amyloidosis. D. Neuropathy. A dialyzer's molecular weight cutoff is 12,000 Daltons. Which of the following compounds would not be able to cross the dialysate membrane? A. Urea. B. Albumin. C. Sodium. Peritoneal dialysis, PD, is different from hemodialysis in which of the following ways? A. PD requires both vascular access and abdominal access. B. PD cannot be done at home. C. PD access is by an intra-abdominal catheter. D. PD sterile dialysate is not required for PD. Which of the following kidney structures connects with and delivers urine directly to the ureter? A. Pelvis. B. Calyx. C. Glomerulus. D. Cortex. A treadmill belt stops for a fraction of a second each time the patient takes a step. A pulmonary function technologist should A. Instruct the patient to use the handrails. B. Tighten the belt. C. Increase the speed of the belt. All of the following substances are produced by the kidneys except A. Renin. B. Aldosterone. C. Erythropoietin. D. Calcitriol. Which of the following is the most reliable method to estimate the effectiveness of the standard procedures to minimize the risk of cross-contamination during spirometry testing in a pulmonary function laboratory? A. Ask patients tested about laboratory hygiene. B. Observe the hand-washing behavior of each technologist. Which of the following conditions is least likely to be caused by uremia? A. Itching. B. Edema, swelling, of the extremities. C. Anemia. D. Urinary tract infection. What percentage of transplanted kidneys are functional 1 year after transplantation? A. 90%. B. 70%. C. 50%. D. 30%. Blood tests for ferritin are performed in hemodialysis patients. A. To check for iron stores. B. To check for magnesium levels. C. As an alternative to hemoglobin concentration. D. To maintain electrolyte balance. Which of the following phosphate binders would best control hyperphosphatemia with the fewest side effects in patients with the end-stage kidney disease? A. Aluminum hydroxide. B. Calcium carbonate. C. Lanthanum carbonate. Which of the following phosphate binders would best control hyperphosphatemia with the fewest side effects in patients with end-stage kidney disease? A. Aluminum hydroxide. B. Calcium carbonate. C. Lanthanum carbonate. Hemodialysis patients should be taught to A. Put in their own needles. B. Weigh themselves and record it. C. Check their dialysis settings and dialysate. D. Do all of the above. All of the following statement about vitamins in daily patients are true except A. Dialysis does not remove water-soluble vitamins. B. Supplemental B-complex vitamins should be given. C. Vitamin D should be given to most dialysis patients. D. Megadose fat or water-soluble vitamins should not given. Osmosis is best defined as A. Diffusion of solute through a semi-permeable membrane from a high to low solute concentration. B. Diffusion of solvent through a semi-permeable membrane from low to high solute concentrate. C. Aversion of hydraulic pressure used in dialysis. In hemodialysis, blood and dialysate have which of the following properties? A. They flow in the same direction. B. They flow in the opposite direction. C. They mix within the dialyzer. D. They do not require a semi-permeable membrane. In the dialyzer, water may be removed from A. The intracellular compartment. B. The intravascular compartment. C. The interstitial compartment. D. All of the above. Which site in the hemodialysis pathway has the highest positive pressure? A. Arterial blood in the afferent tubing. B. Blood entering the dialyzer fibers. C. Blood leaving the dialyzer fibers. D. Blood in the venous. Clearance of low molecular weight molecules by dialysis is accomplished mostly by A. Convection. B. Diffusion. C. Adsorption. D. Solvent drag. The ultrafiltration coefficient of a dialyzer refers to the A. A fluid that passes through the membrane in 1 hour. B. Pressure in the blood compartment needed to force fluid through the membrane. C. Pressure difference across the membrane. D. Fluid that passes through the membrane in 1 minute. Biocompatibility is best illustrated by A. Synthetic membranes that do not adsorb blood proteins as well as cellulose membrane. B. Independence from protein adsorption of the membrane. C. Reprocessed that have a better biocompatibility than new ones. The amount of fluid to be taken from the patient during hemodialysis. A. May be calculated by adding the patient's pre-dialysis weight and the amount of fluid the patient receives during treatment. B. Requires the dialysate to have a higher pressure than the blood. Which of the following pathogens is most likely to be spread during dialysis treatment? A. Hepatitis B. B. Hepatitis C. C. Human immunodeficiency virus. D. Tuberculosis. After a treatment, a patient below dry weight have A. Edema. B. High blood pressure. C. Dyspnea, shortness of breath. D. Muscle cramping. Which of the following alarms must be checked before dialysis begins? A. Blood leak detector. B. Conductivity alarm. C. The pH alarm. D. All of the above. To calculate the amount of fluid removal from the patient during dialysis, all of the following values are used except A. Priming saline volume. B. Saline rinse back. C. Dietary intake. D. Volume of urine output. Which of the following vital signs is abnormal before dialysis in a 30-year-old male patient? A. Blood pressure, 145/95 mm of mercury. B. Pulse, 90 minutes and regular. C. Temperature, 98.60 F, 37 degrees Celsius. D. Respiration, 16 minutes. In a patient with a fistula in one arm and an intravenous line in the other, manual blood pressure should be taken in the A. Arm above the intravenous line. B. Arm above the fistula. C. Leg with the patient supine. D. Leg with the patient standing. A dialysis patient develops a purulent discharge at the exit site of a central catheter. Which of the following pathogens is the most likely to be cultured? A. Staphylococcus aureus. B. Clostridium difficile. C. Enterococcus. A hemodialysis patient suddenly develops trouble breathing, hives itching, and hypotension. The most likely cause is A. An air embolism. B. An anaphylactic reaction. C. Angina. Which of the following may cause hemolysis of red blood cells during dialysis? A. Kinked bloodlines. B. Warm dialysis fluid. C. Inadequate water treatment. D. All of the above. Which of the following veins is most suitable for hemodialysis catheter placement? A. Subclavian. B. Femoral. C. Right internal jugular. D. Left internal jugular. A thrombosis is least likely to develop with which of the following vascular access methods? A. A central venous catheter. B. An arteriovenous graft. C. An arteriovenous fistula. D. All of the above. An advantage of catheter and port catheter devices is: A. They are less likely than fistulas to become infected. B. They have higher blood flows over time. C. Needle entry is not required. D. They are less apt to induce clotting. Using a sterile technique, a hemodialysis technician should avoid all the following except: A. Touching the needle to the outside of a saline bag before penetrating the port. B. Touching the heparin syringe tip or the end of the heparin line. C. Getting the sterile packet wet.